What is a throbbing tooth pain? Throbbing tooth pain is a pain that a person suffers in the tooth which waxes and wanes for the pain that comes and goes. It usually signifies that there is excess blood flowing in the tooth, normally due to inflammation of the tooth. A throbbing tooth pain can be caused due to many reasons, of which some are tooth decay, tooth infection, cracks in the tooth, the failing dental filling or crown, medical conditions like pulpitis, gingivitis, and after certain dental procedures like a root canal. Some people have a condition called malocclusion of the tooth, in which when a person clenches the teeth, all the teeth do not touch each other despite the jaws being fully closed. This can also cause a throbbing tooth pain. What can cause a throbbing tooth pain and how is it treated? Throbbing tooth pain caused due to cavities. If a person has a small cavity in the tooth, then that may cause a throbbing tooth pain, especially when eating something very hot or very cold. A cavity can also be formed due to being hit on the tooth by a ball or when the person is involved in an altercation with someone. This may result in severe nerve damage and lead to a throbbing tooth pain. To detect a nerve dysfunction causing throbbing tooth pain, the dentist will conduct certain tests like putting pressure in the tooth or even taking an X-ray of the tooth, which will clearly detect nerve damage. For treating throbbing tooth pain caused due to cavities, the dentist will recommend painkillers for pain relief. In severe cases, the dentist may also recommend a root canal or complete extraction of the tooth. Throbbing tooth pain caused due to root sensitivity. If your tooth is extremely sensitive, then even with slight stimulation the tooth may start to throb, especially with slight touch, eating too hot or too cold foods, or even extremely cold weather conditions. The best way to treat throbbing tooth pain caused due to root sensitivity is by using desensitizing toothpaste, as they block the pores which send the signal of pain through the nerves to the brain. For optimum results, you will have to use the toothpaste for a minimum of 3 weeks before you see any positive result and relief from throbbing tooth pain. Throbbing tooth pain caused due to gum disease. This is also one of the causes of a throbbing pain in the tooth. The disease to the gums may lead to tooth decay, pus formation, or hypersensitivity, which in turn can cause throbbing tooth pain. To treat this condition, you will have to go to a dentist or gum specialist for appropriate treatment, which may include thorough cleaning of the gums, an invasive procedure to the gums to clear pus and other materials, utilization of antibiotics, and in some cases surgery. Throbbing tooth pain caused due to sinus issues. Some people with sinus issues complain a lot of throbbing tooth pain since the sinuses and the roots are quite close to each other. If even after a thorough examination of the tooth your dentist is not able to identify a cause for your throbbing tooth pain, then you may need to visit your general physician to rule out a sinus issue as a cause of throbbing tooth pain. Throbbing tooth pain caused due to pulpitis. Certain medical conditions can also cause throbbing tooth pain. One such condition is pulpitis. This is a medical condition in which the tooth pulp gets inflamed. Pulpitis is basically of two types, which are the reversible pulpitis and irreversible pulpitis. Reversible pulpitis responds to treatment and gets better, while irreversible pulpitis does not get better even with treatment. The pulpitis may be caused due to mal-fitting crown, tooth cavity, a blow to the tooth, bruxism, etc. Pulpitis can be treated with medications and pain relievers, and in some cases tooth extraction. Throbbing tooth pain caused due to tooth extraction. A throbbing tooth pain can also be caused due to certain dental procedures like tooth extraction. Post-procedure, some throbbing is expected for a few days. The pain will depend on the degree of damage done to the adjoining tissues during the extraction. The dentist will give pain medication for pain relief after the procedure, which the patient can use till the symptoms subside. It usually takes about a week to get rid of the throbbing pain in the tooth due to a tooth extraction. Throbbing tooth pain caused due to root canal. Root canal is a treatment done to repair an extremely damaged or decayed tooth. In this procedure, the damaged area of the tooth is removed. The area is then cleaned and is refilled. Some of the common causes which may require a root canal are cracked tooth, deep cavity, or trauma to the tooth requiring reparative treatments. Throbbing tooth pain due to root canal may persist for some time before it starts regressing after taking pain medications as prescribed by the dentist. Brush your teeth twice a day. Take good care of your teeth. Avoid eating hard foods right after a root canal. These little things go a long way in getting rid of throbbing tooth pain due to a root canal procedure.